1918, a year that marked the end of the Great War, also bore witness to another form of devastation, the Spanish flu. As the echoes of gunfire and artillery faded away, the world began to exhale, ready to embrace a new era of peace. The year 1918 was a landmark in history, not just for the conclusion of World War I, but also for the emergence of a silent, invisible enemy that would claim more lives than the war itself. The world was a different place back then. Cities were buzzing with soldiers returning home, their spirits high with victory, their bodies weary from battle. These men brought back not just stories of valor and camaraderie, but also, unbeknownst to them, the seeds of a pandemic. The political climate of the time was a potpourri of relief, triumph, and reconstruction. Nations were rebuilding, borders were being redrawn, treaties were being signed. Amidst this whirlwind of change, health and hygiene took a backseat. Little did anyone know that these very circumstances were setting the stage for a global health crisis. The Spanish flu, as it came to be known, was not from Spain. The name was a misnomer, born out of wartime censorship. Spain, being neutral during the war, had no restrictions on the press. They were the first to report the disease, and thus bore the brunt of the blame. The world was interconnected in ways it had never been before. Soldiers and civilians alike moved across continents, carrying with them a deadly virus that respected no borders, no class, no race. The world was a global village, not in the modern sense of the term, but in its vulnerability to the spread of disease. In the midst of the hustle and bustle of the post-war world, the Spanish flu crept in unnoticed, its symptoms dismissed as mere post-war fatigue. It was a disaster waiting to happen, a ticking time bomb. As the world was trying to heal from the wounds of war, a silent enemy was fast approaching. The Spanish flu didn't originate from Spain, as the name might suggest. It was a misnomer that stuck. This deadly influenza pandemic actually started in the military camps of Kansas, United States in the spring of 1918. It was during the final year of World War I, and the crowded conditions of the camps served as a fertile breeding ground for the virus. In these camps, soldiers were living in close quarters, and the virus found it easy to jump from one host to another. Initially, the illness was like a severe cold, with symptoms including fever, aches, and fatigue. However, it quickly escalated to severe pneumonia, which often led to death. The flu spread like wildfire, taking advantage of the mass movement of soldiers across the globe. Spain was one of the few countries not involved in the war, and had a free press that reported on the flu, unlike the countries at war, who censored the news to maintain morale. The world, therefore, came to know it as the Spanish flu, even though it did not originate there. As the virus spread, public health responses varied. Some cities imposed quarantines and mandated the wearing of masks, while others failed to take such measures, often due to political reasons or sheer disbelief. In many places, public gatherings were banned and schools, theaters, and businesses were closed. Yet in other areas, life went on as usual, leading to faster spread and more deaths. Despite these measures, the virus was relentless. It traveled on ships, trains, and even on foot, as soldiers and civilians moved around. It made its way to the farthest corners of the globe, from the bustling cities of Europe to remote Pacific islands and the Arctic. In the end, no corner of the globe was spared. It was not just a health crisis, but a social and economic one too. The world was unprepared for a pandemic of this scale, and the initial public response was often inadequate or misguided. Before anyone knew it, the Spanish flu was not just a local problem, but a global pandemic. At its peak, the Spanish flu was infecting 500,000 people a day. This is a staggering fact that paints a chilling picture of the pandemic's magnitude. The Spanish flu, unlike anything the world had ever seen, was an invisible enemy that brought the world to its knees. The peak of this pandemic was not a singular moment, but a series of waves that crashed upon humanity with a relentless force. Each wave, more deadly than the last, compounded the misery and despair that had already taken hold. The death toll was astronomical. It's estimated that between 20 and 50 million people lost their lives to this ruthless disease. To put this in perspective, that's more than the total casualties of the First World War. This pandemic was not merely a health crisis, it was a cataclysm that shook the very foundations of society. It permeated every aspect of life, leaving no stone unturned. Economies crumbled as businesses shuttered, unable to withstand the onslaught of the flu. Unemployment rates soared, and the world plunged into a period of economic downturn. Beyond the economic impact, the Spanish flu also took a significant toll on mental health. As the death toll rose, so did the levels of fear, anxiety, and despair. People were not just fighting the flu, they were fighting their own minds, trying to cope with the unprecedented challenges and the constant dread of infection. The daily lives of people were turned upside down. Schools were closed, public gatherings banned, and homes transformed into quarantine zones. Faces were hidden behind masks, and the simple act of shaking hands became a potential death sentence. The world as people knew it was changing, and changing fast. As we delve into the peak of the Spanish flu and the toll it took, we begin to understand the profound impact it had on the world. It was a time of great suffering and loss, a time when humanity was tested to its limits. The Spanish flu left in its wake a death toll that far surpassed that of the Great War. Just as suddenly as it had appeared, by the summer of 1919 the Spanish flu began to fade. A sense of relief washed over the world as the pandemic's icy grip loosened. The Spanish flu, much like a devastating storm, left in its wake a world drastically altered, forever scarred by its deadly touch. It's important to understand that the end of the pandemic wasn't marked by a single triumphant moment of victory. Rather, the Spanish flu gradually disappeared, fading into the annals of history as the world slowly began to recover. As the number of infections dwindled, life started to regain a semblance of normality. But the world was not the same as before. The pandemic had irrevocably changed the course of history. The aftermath of the Spanish flu was significant, to say the least. The death toll was staggering, with estimates suggesting that as many as 50 million lives were lost worldwide. Each death represented a story cut short, a family grieving, and a community forever changed. The pandemic touched every corner of the globe, sparing no community or social class. But in the face of such devastation, humanity proved resilient. The world did not simply roll over and accept defeat, instead it learned, adapted, and grew stronger. The Spanish flu sparked a revolution in public health policies and medical research. It highlighted the need for coordinated international efforts in disease surveillance and response, paving the way for organizations like the World Health Organization. The medical field also underwent significant changes. The Spanish flu underscored the importance of vaccines and antiviral drugs, prompting a surge in research and development in these areas. It also highlighted the necessity of public health interventions, such as isolation and quarantine, to control the spread of infectious diseases. The Spanish flu was a grim reminder of how a microscopic enemy could bring the world to its knees. It served as a stark warning of the devastating potential of pandemics, a lesson that remains relevant even today. But it also demonstrated the indomitable spirit of humanity, our capacity to learn, adapt, and rise from the ashes of devastation. It is this spirit that we must remember and draw upon as we face the challenges of the future. The Spanish flu, while a devastating event in history, offered valuable lessons for dealing with future pandemics. Hidden beneath the daunting facade of this global tragedy are crucial teachings that, if heeded, could help us better handle similar situations in the future. Firstly, the Spanish flu underscored the significance of global cooperation. In the aftermath of the pandemic, countries realized the danger of a disjointed response. The world understood the need to unite, pool resources, and share information to effectively combat such threats. This led to the establishment of organizations like the World Health Organization, a testament to the importance of international collaboration in health crises. Secondly, the Spanish flu highlighted the necessity of early intervention. As the pandemic spread, delayed responses and underestimation of the situation allowed the disease to take a firm grip on populations worldwide. The importance of swift action coupled with accurate and transparent communication became apparent. It's a lesson that still resonates today, reminding us that when it comes to pandemics, time is of the essence. Lastly, the pandemic emphasized the role of public health measures. Social distancing, use of masks, and good hygiene practices were some of the few defenses against the Spanish flu, in an era before vaccines and antiviral drugs. These measures were, and continue to be, our first line of defense against infectious diseases. They serve as a reminder that sometimes the most effective solutions are the simplest ones. The Spanish flu was a grim chapter in our history, claiming more lives than the Great War and affecting the mental health and economy of the global population. Yet, it was also a turning point, prompting a re-evaluation of our approach to public health and pandemic preparedness. In the face of current and future pandemics, these lessons from the past are more relevant than ever. They serve as a guide, reminding us of the importance of unity, prompt action, and basic health measures. As we navigate through our own trials with pandemics, the Spanish flu serves as a stark reminder of history's capacity to repeat itself.